Hello, this is Dr. Connors. I hope you're getting something, a new look at Lyme disease, and I hope this is beneficial for you. This is presentation number 9. For section number 9, the section that you're reading in this book. Again, the book that you're reading, the download that you're getting is expanded from the book cover that you're looking at if you order it on um, Amazon. Now, why am I telling you that? Because I'm not going to sell as many books. I don't care. I just want you to get better. So we're constantly adding to the information. So we're going to review the process here. It's a lot to go through, I understand. 3 phases of Lyme. Acute phase, defined as it's still within the cell, or excuse me, still within the blood or in the extracellular spaces, and you want to, by all means, catch it at that window. Chronic is that it's entered into a cell, though it is not yet turned into an autoimmune disease. In autoimmune, you're typically in a Th1 dominance with Lyme disorder, and you are have created antibodies against your own tissue. So Th1 dominant patients have to consider alternate ways to treat the disease, because every time they stimulate an immune response, they might feel better for a couple of days, and then they'll just crash. So it just doesn't work that way. So there's a bunch of different non-Th1 stimulators that I wrote about in this section of the book. My favorite is using the Rife. As a matter of fact, we will not even take an autoimmune patient, Rife patient, without them buying a Rife and using it at home. So our protocol is they go home with a Rife machine and they're using it every single night. I program it specifically to their body. So in our plans, autoimmune Lyme patient is in our office for 2 days, 2 full days, while we do a complete workup with them to figure out exactly what we're going to do from a nutraceutical standpoint and also from a frequency standpoint, in testing them exactly what their program is. And I personally write their programs. So we do that with cancer patients as well. Always with Lyme patients, they go home with brain therapies. Very, very important, because if you don't rebuild those pathways, so I just touched on this in the last presentation, but it really is very, very important. You have damaged neurological pathways. We need to rebuild those pathways, and the only way to do that is with brain therapies. It is doable. That's called neuroplasticity. So we need to, if you just remove the inflammation, it's like having a flood that damages the roadway. The floodwaters recede. You have to rebuild the roadway. So that's the brain therapies. So we need to get the floodwaters to recede. That's killing the Lyme. And then we need to rebuild the highways. That's the different brain therapy. So very important in our office. Read this. I'm not going to pause it if you have to read it. We went over it multiple times. So the next presentation, we're going to go deeper into the Rife machine, and it will be hopefully very beneficial for you. All right, I'll see you at the next section.